With the mainstream media starting to push the COVID-19 narrative again, I want to shed light on a situation that was completely preventable. About 2 weeks ago, Congressman Steve Scalise opened an investigation into COVID-related deaths that occurred at nursing homes and long-term care facilities. So what happened? In 5 states, New York, New Jersey, Pennsylvania, Michigan, and California, which are all ran by Democrat governors, they went against federal guidelines and mandated that nursing homes and long-term care facilities had to take in COVID-19 positive patients, as well as patients assumed to be infected with COVID-19. And as early as mid-April, we saw that the data was crystal clear and that the older populations were more at risk to die from COVID-19. And in fact, after that happened, Pennsylvania Healthcare Director Rachel Levine removed her own mother from a long-term care facility, while that option was not available for the rest of us. And the worst part is, after causing this situation, people in these very states were not allowed to bury their loved ones properly, while protesters marched the streets by day and destroyed them by night without impedance from these governors. And as of June 1st, there have been a total of 40,600 COVID deaths in nursing homes and long-term care facilities, which is estimated to be at least 50,000 today. So how did that happen? Watch the video.
As I started looking at the data, we found something pretty alarming, and that is that over 40% of all the COVID deaths in America happened among seniors in nursing homes. Mike, seniors in nursing homes represent about 0.6% of the American population. Less than 1% of the population accounts for over 40% of the deaths.
In Pennsylvania, in perhaps the most shocking and offensive example of all, illustrating just how little government cares about you, the health commissioner of the Commonwealth, Rachel Levine, moved her own mother out of a nursing home before she could fall victim to the resulting death trap. Doug Master.
Last Saturday, we were notified that the facility was in need of body bags for deceased residents. And it was also reported that there were 28 bodies being stored in that facility. Department. We immediately notified. We also sent them additional PPE and the names of individuals that they could call up if they needed additional staffing. The facility was required to institute their backup plan for storage of deceased at the local hospital. On the 14th, we received another complaint that more bodies were being stored.
To help remove some of the bodies. We removed 13 bodies on Monday night. There were believed to be a total of 17 there. The additional 4 that were left were going to be picked up by a local funeral parlor.
All right, Sean. Coming under scrutiny today in Lansing, Michigan's emergency policy of housing positive COVID nursing home patients in nursing homes with COVID-negative patients. State Senate committee.
The Department of Health and Human Services gave us more insight into the regional hub system. There are now 21 of them. States paying these homes $5,000 per COVID positive case they take. We also learned there are some nursing homes taking these patients that do not have the same strict separation policies the regional hubs are required to have. State Senator Pete Lucido is furious.
I'm appalled of the fact that somebody wasn't at each of these facilities before any COVID patients entered these facilities to possibly infect others. How many were infected as a result of bringing a COVID patient to the most vulnerable people in the state?
The Department of Health has instructed California's some 1,500 nursing homes to ban non-essential visitors to protect its elderly residents from COVID-19. But Monday night, it issued a different kind of order. The department directed nursing homes to accept people suspected or diagnosed with COVID-19 while taking, quote, appropriate precautions to prevent the spread of the infection. Dr. Carl Steinberg, a nursing home and hospice medical director in North County, called the order reckless.
What responsible healthcare provider would willingly make a decision to put somebody who has this deadly, contagious illness into a place where it doesn't already exist? I mean, to me, that's essentially being an accessory to homicide.
The Department of Health did not respond to a request for comment. Amita Sharma, KPBS News.
And 4 in hospitals, 36 in nursing homes. Nursing homes are the single biggest fear in all of this. Vulnerable people in one place. It is the feeding frenzy for this virus.
More stunning incompetence from New York Governor Andrew Cuomo. More than 5,000 nursing home residents died in his state after he ordered COVID patients be returned to assisted living facilities. And now he's admitting he wouldn't send his own mother to a nursing home during the crisis. Watch.
If I were advising a friend, I would say you have a vulnerable person. Best to keep them at home and not put them in a congregate facility. Keep them in a situation where you have the most control. That is the blunt truth. That's what I would do with my mother.
The reason you had infections in the nursing homes were because the staff brought in the infection. And you look at the communities that had the high infection rate overall, those are the communities that had nursing homes with a high infection rate.
So 45 states, by and large, did this the right way, but 5 states, Mike, just 5 states, their governors went against the federal guidelines that were coming out of CMS and decided to force those seniors back that were in hospitals. If you're a senior, you were in a nursing home, you started feeling bad, they sent you to a hospital. Well, if you were COVID positive, these 5 governors forced those seniors back to the nursing home and prohibited the nursing home from even testing to see if they were COVID positive, to know if they were. And these are alarming numbers, by the way, Mike. We've identified over 20,000 seniors who should not have died.